I'm Dr. Tim Cummings. I'm co-owner with my wife Jess of Restore Thrive. We're a performance physical therapy practice and training facility.
And I'm Dr. Jess Cummings, and we have 3 small kids, 7.5, 5.5, and 3.5 right now. So we are busy, we work from home, and we're loving it.
With traditional medicine, you're really constrained by time with your provider. The average amount of time that you get with a primary care provider in the US is 7 minutes. What are you gonna do in 7 minutes? You're barely gonna be able to shake the person's hand and introduce yourself, let alone tell your story, go through a detailed exam. And so what happens is in a system like that, we really get pushed into this hole of symptom management where all we're trying to do is figure out something that controls your pain or manages the symptoms, because a good clinical exam is going to take a good 20 or 30 minutes at least, if not closer to an hour. So what we do in physical therapy is really try to get down to that root level of what's causing the problem and come up with a strategy not to just mask the pain, but to deal with the issue, to allow your body to heal and to get back to doing the things that you can't do, the things that you're limited by because of the problem or the injury that you have.
And some people need pain management first before they come see us. I mean, absolutely. I would say that's a very small population of people, but it does happen where somebody blows out their back and they have a disc issue that is so severe. I mean, we are very good at dealing with those things, but if that person can't move at all, there's not much we can do for them until they get some medication or an injection. But those things are just symptom management. So again, with that example of a disc issue, you have a disc issue, you get an injection, it doesn't make the disc issue go away, but it takes away the inflammation so people feel better. But then what do you do about it from a long-term standpoint? You want that disc to heal, and discs can heal, which is wonderful. You don't want it to come back once it is healed. It could be that you're bending over incorrectly, picking things up. It could be that you're picking your kids up incorrectly, or if you have a job that it's a manual labor and you have to pick things up all the time and you're on and off the floor. If you're not doing that well, that disc issue won't heal and it'll come back and you'll have the same recurrent problem again 6 months later or less. So we're really good at those movement-based solutions. You come in, how do we get, again, like Tim said, to the root of the problem, and then helping you figure out how do you solve this long-term so it doesn't come back. And if you have a recurrence of pain, what do you do at home? How do you know how to take care of that without having to come see us? Come see us if you need to, but we're all about empowering our clients.
For us, the reason we started Restore Thrive is because we wanted to really change the way that physical therapy was delivered, and we wanted to give people the care that they deserved. It's hard to get that in this day and age in the medical system, and so that's why we started Restore Thrive in our home. That's why we started out of network. That's why we decided to make our visits longer, is because we felt like people are really what we're about, treating people well. And so that's really our mission, is we want to affect as many people's lives as we can in a positive way at a global level, in our community, in our neighborhoods as well. And we do that when we see people one-on-one. We do that with the media channels that we use as well, pushing out information there. But that's, I would say, our big vision is we want to really just empower people and help as many people as we can feel their best and live their best life.
We want them to learn to do the basic maintenance on themselves, to take care of themselves. A lot of that is missing. We love working with active people, and that it's wonderful to be active. We of course support that, but the problem is people don't know how to warm up or cool down, or and they're at risk for injuries, and they have injuries and they come see us. And so that's a huge passion of ours, is just teaching them, what can you do at home? I want to teach you not to need me all the time. I do what I do for a reason, but how do you learn to take care of yourself, and how do you learn to take care of all the tissues and the joints in your body so that you can continue to stay active and not hurt yourself?
We are the people, if you have a movement-based problem, who are going to fix that problem. We offer movement-based solutions. So if you have a hard time walking, if you have a hard time bending over, if you have a hard time reaching for something overhead, those are movement-based problems that require a movement-based solution, and that's what physical therapy is designed to do. As far as when somebody's on the fence and isn't sure if they're a good fit for the way we practice, the thing we love to do and the way we set up our practice is we've got time to have a conversation with somebody on the phone. So Jess and I regularly will have 15, 20-minute phone conversation with somebody. And what we find inevitably, if somebody has that movement-based problem, it's something that we've seen before, and generally those people are a good fit. But the nice thing about that is that, like Jess was saying, you get time to talk to like a medical provider, and we'll figure out like if you're a good fit for our practice, like we'll let you know. But if we feel like you need some help outside of physical therapy, like we have a good network of providers in the medical field, and we'll get you pointed the right way too. So.
If you're on the fence, just give us a ring. We'd love to chat with you.